Intraductal papillary mucinous neoplasms, IPMN, of the pancreas develop from epithelial cells in the main pancreatic duct, MPD, or branch duct. Histologically, these lesions can be classified into benign IPMNs, hyperplasia, adenoma, and borderline neoplasm, or malignant IPMNs, non-invasive, minimally invasive, and invasive carcinomas. Although the natural history of IPMNs is still poorly understood, all of these lesions are considered to be pre-malignant because even benign lesions such as hyperplasias or adenomas can progress to invasive carcinomas. Thus, even benign IPMNs may have to be surgically resected to prevent malignant transformation. However, the risk associated with surgical procedures should be balanced against the risk of malignant transformation. Thus, to facilitate decision-making, it is necessary to understand the natural history of IPMNs and to identify the IPMNs features that are associated with a high potential for malignancy. The features of IPMNs usually differ from those of ordinary pancreatic ductal adenocarcinomas, PDAC. However, several reports have shown that relative to the incidence of PDACs in the general population, PDACs occur at higher rates in patients with IPMNs. They are also frequently discovered at an unresectable stage. There are two types of IPMN-related PDACs, namely those that infiltrate the IPMN, designated here as IPMN-derived PDAC, and those that are histologically distinct from the IPMN, designated here as IPMN-concomitant PDAC. In recent times, it has become possible to diagnose IPMNs with a variety of imaging tools. Endoscopic ultrasonography is superior to the other available imaging methods in terms of spatial resolution. In the present study, Kamata et al. Investigate the natural course of branch duct IPMNs by using 4 imaging modalities: EUS, ultrasonography, computed tomography, and magnetic resonance imaging. In particular, the frequencies of cystic lesion changes and IPMN-derived and concomitant PDAC development during follow-up were determined. Additionally, they compared the diagnostic accuracy of the 4 imaging modalities in terms of the detection of IPMN-derived and concomitant PDACs. The authors report their findings in their paper entitled Value of EUS in Early Detection of Pancreatic Ductal Adenocarcinomas in Patients with Intraductal Papillary Mucinous Neoplasms. Here's what they have to say. Background and study aims. Pancreatic ductal adenocarcinomas, PDAC, sometimes arise in patients with intraductal papillary mucinous neoplasms, IPMNs. This study examined the incidence of PDACs concomitant to or derived from branch duct IPMNs. The usefulness of endoscopic ultrasonography relative to other imaging methods for detecting these tumors was also assessed. Patients and methods. This retrospective study used data from clinical records and imaging studies that were collected prospectively. During 2001 to 2009, 167 consecutive patients with IPMNs underwent EUS, ultrasonography, computed tomography, and magnetic resonance imaging. The 102 patients whose branch duct IPMNs lacked mural nodules symptoms and thus did not qualify for resection were followed up by semi-annual EUS and annual ultrasonography, CT, and MRI. The sensitivity and specificity with which the four modalities detected IPMN-derived and concomitant PDACs at the first examination and throughout the study period were evaluated. The rate of PDAC development during follow-up was analyzed with the Kaplan Meier method. Results.